Hello, hello, hello. 212, 212, testing, 21212. Right, first YouTube live I've ever done. This is, and I'm hoping it's working. I've done quite a lot of Facebook lives. I do them. I look a bit scruffy, don't I? I was thinking of putting a better shirt on. Anyway, I don't know if anyone's there. Is anyone there? Hoping the audio's working. Is the audio working? I hope the audio is working, because I tried it the other day and I was talking to myself because the audio wasn't working. Oh, look at that. We've got Shirley. Hi, Shirley. Hi, Shirley. Can you hear me? Can you hear me? Hi, Karen. Is the microphone working? Yes. Yes. Is it this microphone or not? I don't think that do anything. Loud and clear. Loud and clear. Loud and clear. Right. I haven't dressed up, but that's all right. Well, I don't know if anything's going to happen on this one. It's a YouTube live. It will be back on Facebook Live when I get back on Facebook. But I was going to talk about my book, wasn't I? That's reminding me of my book. I'm going to advertise that because I've got a question related to that. Right. Okay. So audio's working. Good. Right. So I've got a couple of questions that I've got. I've only got a couple. I didn't know how this was going to pan out. So here we go. So we've got a question here. Hello, I have been looking at your mummy makeover package, the tummy tuck and breast lift. I've also looked at a similar package in Prague. Can I put this on the screen? I don't know. Anyway, and being given an estimated price for that. I'm trying to find out whether there would be a great difference by the time, flights, accommodation, etc. over there would be compared to having the surgery done in the UK. If you could give me an estimated price for the mummy makeover package, please. So we've given you a price for the mummy makeover package. Oh, something back there. And I'm going to talk about that sort of thing because this is a good point here. Because the interesting thing is when people inquire about stuff, the most the thing that they always say is, how much is it? What is the price? And I'd understand that. I'd probably say that if I was looking for something, hip replacement or something. So I feel at the moment, anyway, with a hip, dodgy back and all that, back replacement. If I was looking for back replacement surgery, what do you look for? So the first thing you want to know is, say, what's the price? So if you're looking purely on price, you will find it cheaper in Prague, I suspect, or abroad. I don't want to sort of pull out a particular place. She's just mentioned Prague, but overseas. A lot of people go overseas for surgery. It's a very big industry, and it is obviously appealing because otherwise people wouldn't do it, because obviously it's a bit of hassle to go abroad. It'd be easy to have it done here, but the reason they do it is because I believe it is significantly cheaper than having it done in the UK. So if you're purely looking at price, yes, you will find it better with going abroad for surgery. And I think you'll find most people in the UK won't be able to compete on price in terms of going abroad. But there's a lot more than just price. And the problem is it's easy to ask about price. And one of the things that I try and get across to people is to think about what sort of questions you've got to ask, because a lot of people don't know what they're supposed to ask. Because if they don't know what they're supposed to ask, they can't tell whether one's better than another one, because they don't know the difference between having it done in UK. Even in different places in the UK, there'll be different prices, and going other countries there's different prices. So the differences will be, or the things to look out for, I would say, when you're having surgery of any sort, is first of all qualifications of the surgeon. That's where the right, that's where my book. Yeah, never accept. Is that there? Never accept to lift. Oh, is that all reversed for you? Oh, anyway, written a book. Why have I written a book? I just want to see that scratch. I've written a book because there is a difference between having it done with different surgeons, because the surgery, there is no standard to say who is supposed to do this sort of surgery. When I say this sort of surgery, I mean cosmetic surgery. What we're talking about here, mummy makeover, tummy tuck and breast lift. You would think that plastic surgeons would be doing that sort of surgery, and plastic surgeons do that sort of surgery, but there's a lot of other surgeons that do that sort of surgery. In fact, probably more is done by non-plastic surgeons than by plastic surgeons, certainly in this country, because there's a lot of people offering this sort of surgery. And even when you go abroad, you might find that they are plastic surgeons. They are fully trained plastic surgeons abroad. But one of the things you've got to look out for, whether you're going abroad or here, is what the training of your surgeon is. So first of all, you're looking for a fully trained plastic surgeon, Exhibit A. That's number one. A lot of people will not be fully trained plastic surgeons. If you want to know if in this country, if someone's a fully trained surgeon, then you're looking for FRCS and then brackets a specialty. So Plast is plastic surgeon. If it just says Ing, E-N-G, that just means it's England or Ireland or Scotland or whatever. So, but that just means they've got a fellowship of the Royal College of Surgeons. They're not a specialist. A specialist will have something in brackets afterwards, ORL for ENT surgeons, otorhinolaryngology, or GEN for a general surgeon, or ORTH for an orthopedic surgeon. So if they've got letters in brackets after their FRCS, then they're a specialist. If they haven't, they're not a specialist. And it's okay in this country to do mummy makeovers, tummy tucks, breast lifts, goodness knows what, if you're not a specialist. There's no law to say that a surgeon has to have finished specialist training. That is the problem, because a lot of people assume that they have to have a specialty and they have to be a specialist. There is no law to say it. All sorts of doctors do it, and there are people who aren't specialized in anything who are doing it. So that is number one problem. And by specialized, I mean you do 6 years of training after you get your FRCS in a certain specialty, whether it be orthopedic surgery or general surgery or plastic surgery. So to get FRCS Plast, you have to do 6 years of specialist training just purely in plastic surgery. So that's the first thing to look out for, a specialist, a fully trained specialist. Second thing, particularly if you're going abroad, the training is different in different countries. So a trainee will be trained to different levels if you're trained in the UK compared to if you're trained in different countries. In Italy, for instance, a lot of the structure of the hospitals is different to the structures here. And in Australia as well, it's similar to Italy in that in Italy and Australia, these are just places that I've worked in, so I know, they have a professor who oversees everything, and the consultants work under the professor, and they do a ward round once a week, and they present their patients to the professor, and they get guidance from the professor. In the UK, we don't have that system. Once you're a consultant, there is no one above you. We do have professors in the UK, but the professors aren't above the other consultants. When you're a consultant in the UK, you are a fully independent practitioner, and you are totally responsible for patients yourself on your own. So you are the training in the UK is to a level where you are completely once you're a fully specialist, fully trained specialist, the exams that you finish on are aimed towards you working as an independent practitioner. So if you've got those letters after your name, then you have been deemed by the Royal College of Surgeons to be able to look after patients as an independent specialist. The problem is there's no law against people who haven't got those letters after their name looking after patients as an independent specialist. I'll talk about that in a minute, but there's no law against it. So that's why you have to look for those letters. Now, having said there's no law against it, the private hospitals, the big ones like BMI, Ramsay, Spire, Nuffield, all the big companies, you can't work there unless you are fully trained. So there is a sort of a safety net there. But the problem is certainly in plastic surgery, and it is a problem pretty much unique to plastic surgery, that there are cosmetic companies that then have their own hospitals, and then they can employ anyone to work in those hospitals. So there are people who aren't fully trained providing the service because they're working in hospitals which are owned by the companies rather than working in the local private hospitals. Other surgeons don't have that. Orthopedic surgeons, cardiac surgeons, neurosurgeons, they don't have that problem. So all orthopedic surgery and cardiac surgery is done at the main hospitals, the main private hospitals, and so all those surgeons are fully trained. So that is Exhibit A. So you have to work out they're fully trained. And Exhibit B, the training is different in different countries. It doesn't mean it's better in one country than another. It's just different. Like, again, for instance, in Italy, plastic surgeons don't do much hand surgery. I'm not sure if they do any hand surgery. In the UK, a large part of plastic surgery, is hand trauma. So a plastic surgeon will be trained at different levels in different countries. In Australia, going back to these places that I've worked, plastic surgeons do a lot of bony work in the face. So if you have a facial fracture, the plastic surgeons will fix that facial fracture as well as fixing the soft tissues. In the UK, they're not. In the UK, maxillofacial surgeons will fix the bony fracture, and the plastic surgeons just deal in soft tissues. So it's different in different countries, not right or wrong. It's just different in different countries. So it can be difficult to tell what sort of level someone's trained in a different country, because the training structure is different. That's one thing to look out for. The other thing to look out for, so the two main things, I think, are the surgical training and the aftercare. I think the aftercare is really important. And the good thing about cosmetic surgery is that it is very safe. There's not many problems. There's not many complications. But if you do get a complication, if you do get an adverse outcome, then you can be a bit feeling like you're a bit left high and dry. Now, I'm saying that because I've seen people who've had surgery overseas who then come to me and want me, or come to the local private hospitals and want to be looked after. And we're like, well, you've had the surgery, in wherever. Really, you should go to see your surgeon. So you just got to make sure. I don't know what the setup is, but just make sure what the setup is. Ideally, you should be seeing your surgeon for follow-ups, and ideally, you don't really want to go back to that country. So I don't know if they do it so that the surgeon comes over here and sees you for follow-ups. But the other thing is, if you need surgery, sometimes you need a little bit of surgery, a little bit of a nip and a tuck, a little bit of a problem. And it's just a bit of an issue if you have to go back. So that's the other issue that you've got to look out for. What's the aftercare? I've seen people advertising saying, if you have a problem, ring your GP. I'm like, well, GP's not really going to help you if you have a tummy tuck and a breast lift in Prague, and then you've got a problem with the wound. The GP's not really going to be able to that much help unless you have a really serious problem and you need serious hospitalization. If you're just not happy with the result and think one's a bit bigger than the other, or there's, the tummy tuck's not quite right, GP's not going to help really. So just look at the aftercare and just be aware that there are reasons for the prices to be different. So those are the two main things I think you should worry about if you're thinking about going abroad. And you might come to the judgment that it's still okay, and that as long as you make an informed decision, then that's fine. The other thing you might say, well, why is it so much cheaper abroad? Why do we charge so much more here? Do we get paid a lot more money here? And I think one of the big things that we have here is we have to be covered with our insurance. The insurance is huge over here, so we have to be covered. It's something like, I think it's something like 5 million for an individual case and 10 million over the year is our insurance cover. So we have huge insurance premiums, which again, they may not have the same insurance premiums, particularly if they're not a plastic surgeon. So that's, the plastic surgeon, if you're a plastic surgeon, your insurance premium is a lot higher than if you're a different type of surgeon. So we do have to pay a lot in terms of the insurance, but then that does cover you, because if you have any problems or anything like that, and you feel that you haven't been treated properly, then there is insurance there to cover you if you if you pursue that. Whereas if you pursue someone who's not insured or is not insured to that level, then you may not have quite as much of a comeback if that does happen. Again, that's a rare thing, so but it's just something to be aware of. So I think it's about question making a balanced decision. I think a lot of surgeons will say, don't go abroad, it's terrible, it's evil. But the fact of the matter, a lot of people do go abroad. So I would say make a balanced judgment. If it is cheaper, I think it will be cheaper. And you may think that the extra value that you're getting by having surgery here is not worth it, in which case, fine. but you have to just know what the extra value is. And if you just ask for the price, you won't know what the extra value is. So you have to know level of training, experience, the quality of the result you're going to get, and also the aftercare. So the other thing is look at the aftercare, speak to people who've had it done in the plate. If you're going abroad, speak to people who've had it done, look at the results, see if the results are good. You know, do your research basically. Yeah, that's a good question. And thanks for that question. We've also had someone who has phoned up. She's had surgery by me, and she is worried because she's got a lump. In fact, I've had someone else I saw the other day. Anyway, this is for this person. She's phoned up. She's felt a lump, and she's extremely worried. But she lives up in Sheffield, I think it is, and so she's worried and wants to see a surgeon and is concerned. And the first thing I would say is, well, if someone's got a lump, and well, this is for someone who's got a lump who's got breast implants. So she's got breast implants in and she's got a lump. The first thing is really, well, first thing, if you had a lump in your breast, you've got to seek help. So the first port of call is probably your GP. Your GP might be able to help, might be able to ascertain it, but the main thing you've got to ascertain is whether it's a lump in the breast or whether it's a lump in the implant. So your GP might be able to help, it might be obvious, or they might say, oh, look, you've got implants in. So it's perfectly reasonable to go and see me or your plastic surgeon, because if it may well be a lump of the implant. It may be a lump or a knuckle, or it may be the implant that you're feeling. So, and this is like 6 years, I think, ago I did the surgery. So the first thing is come back and see me, stroke your surgeon, to see if the lump is around your implant or is it around your breast. And your surgeon might be able to say, look, that's a lump of your breast. That's a knuckle of the implant. Sometimes when the implants just get an implant on them. Not prepared. Sorry, right. Sometimes when you have an implant, this is an implant here. If you get a bit of a capsule, hold up. If you get a bit of capsule, bit of tightening, right? The implant, the capsule starts tightening, and you get an edge. Can you see that knuckle? You get an edge there. So sometimes, as the capsule tightens around it, you get a little bit of a knuckle, and you think, "Oh, that's that lump. I can feel that lump." Yeah. So that can sometimes happen, and you might clinically be able to feel that. Say, actually, that's a knuckle of the implant. That's okay. I won't worry about that. That's normal. That can happen. And usually the lump in itself doesn't bother people. They're just worried. Obviously worried about breast cancer and what have you. So the surgeon might be able to say, you know what, that's a lump of the knuckle of the implant. Don't worry about it. Or they might say, actually, you know what, I think that might be a lump of your breast tissue, because you can actually usually tell the implant sort of around behind the breast. The breast tissue is on top of the implant, even whether the implant's on top of or behind the muscle. The breast tissue is on top of the implant. So, hi Tracy, nice to see you. Yeah, working well. Yeah, first YouTube live. See how it goes. So the knuckle could be the implant, or it might be the breast tissue. If it is the breast tissue, if there's concern that it might not be the implant, then the thing to do is to then seek help. What we normally say, and this is where things can get a little bit confusing, is that what I would normally do is refer you to a breast surgeon. And people sometimes look at me and think, wait a minute, hold on a minute, you're just telling me you've written a blinking book about how to choose your best surgeon for your cosmetic breast surgery. You're telling me that you're some kind of expert in the breast, and now you're referring me to a breast surgeon. Hold on a minute. So it is a bit confusing, because I'm not a breast surgeon. I'm a plastic surgeon. Now, I pretty much only do breasts. I do tummies and body contouring, but I don't do any faces. So I am a plastic surgeon that specializes in plastic surgery of the breast. I'm not in the hospital setting. I would not be considered a breast surgeon. A breast surgeon is a general surgeon, so they'd be FRCS Gen, GEN, who then specialize in breast. And it's the general surgeons who deal with breast lumps, breast pain, breast cancer, scans, etc., etc. So if someone comes to me with a breast lump, say they haven't got implants in and they've got a breast lump, I'd be like, well, you need to see a breast surgeon. And that breast surgeon would investigate you. So what I would normally do is I'd write to your GP and say, look, this lump, I don't think it's part of the implant. I think it might be, a thickening or a lump in the breast tissue. So it might be worth getting it investigated. And referral to a breast surgeon. So a breast surgeon would then be able to see you and do things like do a scan and biopsy and what have you. Now, obviously, you've got to tell the breast surgeon you've got implants in because they've got to adjust the way they do things. They can do things just the same. There's no problem having implants in if you've got a breast lump and need investigation. There's no problem with it. You just got to tell them you got an implant in, because if they have to do a biopsy of it, if you can feel a lump, what they normally do is they stick a needle in and try and aspirate a little bit of the lump to get a tissue biopsy of it. Now, if you've got implants in, they probably wouldn't just stick a needle in. They'd probably do an ultrasound guided biopsy. So they can still do a biopsy, but they just do it under ultrasound guidance. Similarly, if they're doing a scan, so it's like a mammogram, they'd have to change the angle of the scan that they would do it. They do it slightly differently than if you didn't have implants in. Something like an ultrasound would be fine with implants in, but again, obviously you got to tell them. They're going to find out pretty quickly if you do an ultrasound anyway. But you just got to let them know. Now, the implant's not going to hide any breast lumps or anything like that. The breast tissue will always be above the implant. There won't be any breast tissue, but behind the implant, whether it's on top of or behind the muscle. So you'll still be able to feel the implant, feel lumps or things like that just as well. But you do have to let them know, and they can investigate you appropriately. So if you do have a lump and you've got breast implants in, the first thing is to seek help by someone, whether it be your GP or your plastic surgeon, doesn't matter. Just go and see someone. But I think it'd be perfectly reasonable for the GP or whoever to say, look, it might be a breast implant, and get checked out by your plastic surgeon first, and then if it's not, then it'll be a sort of different sort of surgeon, a breast surgeon, and that sort of stuff's investigated really well in the NHS. They've got it really slick the way they investigate breast lumps within the NHS. So that's often done with the NHS. You can have it done privately, but you can often get referred back into the NHS for that sort of thing. So I think that's all I got. Yeah, that's it. I think I got no way of putting titles or anything on here. This is a new thing for me. I don't know what. I think I'll put a comment in, but yeah, that's all I got. Sorry, I didn't. Anyway, I just thought I'd sort of ease into my first YouTube live. Ease in. Is that loud? Is it this microphone? Is this louder than this? Hello? Anyway, yeah. So I do feel a bit of a scruff. I don't think I've presented myself well for my first Facebook Live for new Facebook Live viewers. They're probably thinking, what's this scruffy guy? I normally have the thing down there saying who I am and stuff. Anyway, there you go. So if anyone's got any questions, can ask them in the chat, or put them in the chat. Is it chat or comments? Put them in the comments afterwards, and I'll look for them and ask them. I'll do this again next week. Now, who knows? What I might do is do it on Instagram, because I don't know. I did an Instagram thing earlier. I thought I was limited to how far you can talk on Instagram, but I might do an Instagram live next week. Got 4 weeks of ban. I think I've got 24 days left of my ban on Facebook. So yeah, so I'll be looking for alternatives. So I might do YouTube live. I might do. It's louder than the mic. Is it? So the mic is working. Okay, I didn't think it was working. So I'm going to check myself out and go and I might dress up a bit next week. I do feel a bit bad now. I'm looking at myself. Didn't realise I looked this scruffy, to be honest with you. T-shirt's not very good, is it? Anyway, hey ho. Can't change it. It's out there. Look at that T-shirt showing there. Oh dear. Sorry about that. I'm going to go away now, and I'm going to carry on with my evening. If you have any questions, please ask them, because that's what I do, to ask questions, and I will answer them next week, Tuesday night, 7 p.m. YouTube/Instagram Live, or whatever, with Periscope. Is Periscope still going with Twitter? Anyway, probably Instagram Live. I'll give it a go. I might have a bash with it in the week. If not, back on YouTube Live. I'm checking myself out now. Thank you, everybody who's here. And I don't know if you can watch this afterwards. I don't know, but anyway, if you can, hello. If you're watching it afterwards, hope you enjoyed that rambling. I'm going to end my stream now by clicking here, and I will see you next week, same time, maybe the same place or a different place. Let's do this. End stream.